So whether that's for work or study or visiting family or having adventures, missionary work or aid work. So it's a vast area of intersecting interests. And so I hope this course will help you get an idea of the breadth of travel medicine, and perhaps it'll inspire some of you to learn more about it, learn more in depth about it, and inspire some of you to become involved and join our community. So thank you. Thank you for having me.
Thanks, Lynn. So we're going to start a little bit earlier, but before we start, I have to do, the important housekeeping. And so I want to say a number of things. You got an agenda and there are breakout groups. And in these breakout groups, there are different links. So you will leave, when I announce it, you will leave this link and go to whatever breakout room you want to go to. You'll go to that link. If there are problems, you have Anne-Marie Tenati's email, you can email her. And she'll be manning her email and everything else. And we'll thank Anne-Marie after. So that's one of the things. Questions will go in the chat box. Here, the questions when we're on this webinar will go into the Q&A, if you could keep them in there. And then when we're in the breakouts, you'll put it into a chat box because we're all using our own Zoom links. And then the other thing that I wanted to say to you is that instead of a break, I put a cases in there and I cut down our panel a little bit. So I'm going to do a travel case and then I'm going to give you a break. If you need to go on and off, that's great, but always come back because there'll be a lot of information today. I want to say a personal thank you to ISTM, and I also want to say one to everyone here at Einstein. So Anne-Marie Tenati, who is applying to medical school, she comes to us from Columbia, and we're really lucky. She's been supporting this grant for the past year. Her parents are from Ghana, and so she has a strong personal interest in the work we do with the West African community, and I feel really lucky to get to mentor her this year. I'm going to have the breakout groups. There's a number of clinicians that will be manning them, but I'll also have some of my residents. They're not probably on yet, but Cesar Berto, who comes to us from Peru, is one of my chief residents and looking at ID, will be manning one of the breakout groups. Daniela Jarin, who's an intern who comes to us from Ecuador, and she's interested in ID, and she's going to be manning one of the breakout groups. And my PA, Mike Claudius, is also manning the breakouts, and I keep on telling him that travel is great because it's not only different, all the different areas I spoke about, there's different subspecialties and different specialists. And so there's PAs, nurses, there's pharmacists, and we're all in this together. And so I think it's multidisciplinary also, which I think is really, really wonderful. So with those thank yous and my housekeeping, it is my great pleasure to introduce Rebecca Wolf Acosta. Rebecca resides here in New York, and Rebecca also is both a colleague and a friend. She is a nurse by training, and I think I really want to say when I first started at ISTM a million years ago, and I first went to the meeting, I was struck by how many nurses were running workshops and leaders and giving input and working closely hand in hand with the physicians. And so this is something I love about ISTM. I feel like I'm a TV commercial, but whatever. Sorry about that for the participants. She has been providing travel health care for over 30 years. She's worked abroad. Her father was a tropical medicine expert, and so she has a lot of experience growing up with tropical medicine and exposure, which I think did spur her interest in this. She's an internationally recognized expert in pre-travel healthcare practice, and her passion is pre-travel consultation and best practices in this very unique, special area. And she's not going to talk about it today, or maybe she will, but during the COVID pandemic, she became a very important figure in the New York City school systems because people really needed this type of expertise. So a lot of people had to parlay this expertise that we learned in travel medicine during COVID and pivot a bit. She is an active member, of course, of the International Society of Travel Medicine, and she was selected to participate in defining the body of knowledge, which you're going to hear about from Lynn in the travel medicine exam, our certificate exam. She is recently the co-lead of our COVID task force, and she's a fellow of the ISTM, and she is in the leadership. I can't say enough wonderful things about her. Thank you for bringing your expertise, because she's going to be talking to us about the ABCs of starting a travel clinic, and there is no one better to talk about this topic. Rebecca, thank you for joining us today. You can start sharing, and I'll let you know when we see your presentation.
Okay. Hi, everyone. Can you hear me?
I can hear you, Rebecca. I'll speak for the group.
Okay, great. I don't know if you can see me anymore, but here I am. It's wonderful to be here today, everyone. And I just want to, say that this will be an ABCs workshop. Even those of you who are already practicing, I hope there will be a few take homes here. I call them pearls of wisdom, things that I continue to learn as I go along. We're never finished learning. We can always perfect what we do, add in to how we manage patients, our methodology. So we really learn from each other and in this rich community that we've heard about already. So I hope there'll be something for everyone here. I do want to mention that my talk will be primarily US focused with a slight slant towards New York State, because this program initiated to help providers in New York, particularly dealing with the VFRs, visiting friends and relatives community. However, I think there's much standardization now in what we do. So, please, for those of you who are outside of the US, do forgive the slant towards the US, but that is just important for beginner providers to understand where they can go to get this knowledge. And acknowledging that, I want to say hi to Oscar. I did see him saying hi from Paraguay. I've been to Paraguay and carried around my TED can, and it was a wonderful place. And hello to all of you from all over the place. All right. So as I have been in the field for over 30 years, and the field has evolved considerably. There are now very defined and accepted standards of care and many resources to support quality care.
Rebecca, we can't see your presentation yet.
I'm sorry, how you can't see it.
Do share
it's
screen.
Up on my screen. Okay, hold on. I have to close it out. 1 second. Sorry, guys.
That's okay.
All right.
Sometimes you have to share your Yeah,
there
perfect. It's starting to come.
Can you see it now?
Perfect.
Okay.
You're all good.
All right.
Yeah.
Okay.
I'm gonna mute myself.
Okay, so there we go. Sorry, guys. Anyway, and girls and everybody. I tend to say guys. It's a thing from the 1980s for those of us who grew up way back then. Anyway, today I'll be presenting the ABCs, as I mentioned, and just to remind everybody, it's not as simple as just filling your refrigerator with vaccines and thinking that you can do travel medicine. It's much more complex than that. And I will be hinting at that throughout this presentation. So I hope let's get started. I do have a few disclosures to companies I've done some recent consulting with that are involved in the travel health market. So our objectives today. My goal is to raise your awareness and understanding that, like other areas of healthcare, quality travel health depends on accepted guidelines and standards and the use of resources and tools to support what we call best practice. I'll be reviewing some of the essential resources, highlighting some of the barriers to best practice, and breaking down the elements of the pre-travel consultation process. Appreciating all that is involved is an important step to being able to pull it all together into safe, effective, and efficient care for your travelers. There are things I won't be getting into today due to time constraints or because they are too specific to where you practice. This includes billing and coding, business operations, marketing, and legal issues related to practice. However, these are other very important considerations for any successful and sustainable medical practice. We are also not going to focus too much today on the topic of COVID, but it's important to recognize that anything to do with travel is not business as usual during the pandemic. People are still traveling, but international leisure and business traveling particularly is way down. For those who are traveling, every consultation needs to weave in reminders about COVID risk and considerations for pre and intra-travel testing, and how to seek medical care abroad in countries that may be having a surge. This can be a real problem for people who have flare-ups of illnesses when they travel. For those, we also have to adapt practice, which may mean consolidating hours and adjusting staffing even further. Many providers in travel medicine have needed to shift to COVID or other areas of need. They may need refreshers and updates when they return to practice. We all get rusty if we don't do something after a while. Vaccine inventory has to be carefully managed because of lower utilization. There's shelf lives for vaccines, so you have to be more on top of that. Consideration must be given to COVID precautions in all aspects of healthcare, including the travel clinic. The pandemic has also accelerated the demand by providers and patients for integrating technology such as online registration forms and virtual phone or video visits. These require the same level of management as in-person care. I'm an optimist. There's pent-up demand and travel will bounce back. Many travelers may be more interested in becoming informed and prepared in the wake of the pandemic. As Hans Christian Andersen wrote, "To roam the roads of lands remote, to travel is to live." Even with COVID as an ever-present issue for now, the fundamentals of travel medicine haven't changed, and we just have to continue to adapt. Travelers need us. We need to do a good job with travel preparation and get more people to seek our services, as Dr. Coyle mentioned. Surveys indicate that as few as 10% of some travel populations seek pre-travel healthcare, and this is very problematic. We must be prepared to meet the needs of high-risk and more complex travelers, such as those visiting friends and relatives, adventure and rural travel, mature travelers, and those with pre-existing conditions. And we need to realize that we can't prevent everything. We must help travelers anticipate, reduce, and manage risk. In a nutshell, travel medicine and travel healthcare are all about identifying, preventing, anticipating, and managing health risks of all people, including migrants and refugees who cross international borders. The terms of travel medicine and travel healthcare get used interchangeably and share much of the same knowledge base. However, travel medicine can be seen as a larger umbrella or a piece of the pie, as it can also encompass expertise in post-travel medical care. We are a very diverse interdisciplinary group, as Christina mentioned. We come from many areas of specialty, all bringing unique and valuable background and expertise with us. Travel healthcare is also provided in many different settings, from public health, primary care, pediatrics, ID, and the military. So this can inform how we practice, and in many different types of institutions. So once again, everything has to be fit into the type of institution and practice that you have. Various levels of travel healthcare can be provided within an existing practice, even short of having a full developed travel clinic. Some of you may already be doing some of this. New York State strongly recommends that all healthcare providers help their patients by building awareness of travel health, screen for upcoming travel, and keep routine vaccines up to date. When you have a primary care visit, ask people, are they planning on vacationing? Where are they going? Are they taking their children? Have they thought about the preparation? If you can't help them, you can always refer them out for complex needs or all the travel vaccines. It's okay if you don't stock everything. Flagging people for this need is one of the most important things you can do. At an intermediate level, the ability, you can offer more complete travel consultations to your patients, administer most vaccines, and refer out for vaccines you may not stock, such as yellow fever or Japanese encephalitis, and for those with complex medical needs. At the proficient level, you can meet the needs of most travelers. The important thing is to know where you appropriately fit in this spectrum and stick with it until you develop more knowledge and the resources to expand what you offer. So what is a travel clinic? Based on the title of this course, many of you may be attending today because you are curious or ready to start a clinic. A travel clinic or travel health practice doesn't need its own physical walls and space. It can be housed within many types of practices, as we've already mentioned. However, it does need to offer these basics to be reliable. You must be able to offer a consistent standard of travel health care to your defined population in preparation for travel. You may be open to the public, which means you have to be ready for any and everything. This is particularly important for yellow fever vaccination centers that may be available to the public. You can specialize in certain areas, and that may depend on the population that you're serving. And your clinic may also provide post-travel and tropical medicine, but not all travel clinics do. You have to maintain clinical staff with a high level of knowledge and experience in travel healthcare and stock a full range of routine and travel vaccines. If you're already proficient in travel healthcare, you may be ready to start a clinic. It's essential to understand what is expected to ensure your traveling patients will get quality care from all those involved. Here is a moment of caution regarding yellow fever vaccine. Being authorized by New York State and many other states does not have any direct link to knowledge or competence and does not turn you or your practice into instant travel medicine providers or a travel clinic. It comes with a lot of responsibility and takes knowledge and experience to appropriately offer the vaccine and the other related care and services. Start off slow, as I mentioned before, and build up to becoming a yellow fever provider and managing the needs of more complex travelers. When you and your practice are ready for this process, in New York State, you can call the Department of Health. They will email a 2-page application, and you will see that the simplicity of this application does not ensure knowledge or competence in travel healthcare. That's why it's good you're here today, to understand all that it takes. Let's look at some of the challenges to quality and impactful care. On the provider side, we need an understanding of the knowledge to be competent in putting the knowledge to work and then deliver the care in an organized and time-efficient manner. In a few minutes, we'll be getting into some of the nuts and bolts of this. What the traveler brings with them is also critical and can add challenges. Recognizing that these issues, such as cultural influences, past travel experiencing, cost concerns, language barriers, and fear of needles, can have a big impact on how travelers perceive and manage risks. Every traveler brings their own unique set of influences. The better informed, organized, and prepared we are, the more we can weave in understanding of who they are and what will be most helpful and impactful to them. Today's lecture will provide an overview of what you need to know, along with what can build to as developed expertise and specialization. Many of these topics will be focused in the upcoming lectures. From altitude issues to Zika virus, it's a robust knowledge base. As your knowledge and competence expands, you can offer more specialized advice. Being aware, even if not proficient, of the entire knowledge base will also allow you to appreciate what you don't know and when it's time to refer your patients on to colleagues or others until you are ready to manage more. This slide summarizes what can be considered the core of the fountain of knowledge of being able to provide travel healthcare in the United States. The CDC is one of the most reliable resources available to guide practice in the US. The Yellow Book, which is basically our Bible, it is available in print and online. It's called the Yellow Book because for many years it has been yellow. Looking at the most recent cover, it doesn't look that way anymore, so maybe we should call it the Black Book. But it's still got all the good stuff in there. The free online version offers travel notices on outbreaks and very helpful country destination pages to guide the travel consult. And there is also a phone support line. The Pink Book, now also looking a bit somber with its dark color, is stuffed with information on vaccines and is a must read. The CDC offers a 2-module course on yellow fever and vaccine. It's free, and you can also get CE and CME, which should be mandatory for anyone advising travelers or authorized to give yellow fever vaccine. Don't miss the ACIP, the Advisory Committee on Immunization Practices. They advise on all things vaccine, including updated recommendations, standards for vaccine administration, and more. One of my frequent visits is to immunize.org. We'll be talking soon about vaccine information statements and standing orders. Get them right here. If you use and base your practice on these essential standards, you will be well on your way. Of course, it's not as simple as memorizing the Yellow Book. If you are not already familiar with these professional resources, please make sure to learn more about them. You'll be hearing more today about much more about the ISTM from several of my colleagues, so I won't spend too much time on that. I also want to acknowledge the recent accomplishment of the American Travel Health Nurses Association, which I was a co-founder of. They have developed the scope and standards in travel health nursing, which was approved by the American Nursing Association. This is a tremendous accomplishment and will have a lot of impact going forward on the practice of travel health care in the United States. Shoreland has some very helpful information available at no charge, including a detailed clinic guide and country information. It can be enhanced with a paid prescription. It's always good to review professional practice standards for the state you practice in. The U.S. State Department offers the STEP program for travelers so they can register with an embassy and receive security alerts. Finally, you can sign up to receive ProMed alerts about global disease outbreaks impacting humans, animals, and plants. Gaining a knowledge is only part of the answer to managing the challenges. In travel health literature, it is mentioned to become competent, and provider must see an average of 10 travelers a week. Gaining competency is a real challenge, but you can get started by becoming familiar with the pre-travel consultation process and understanding where all the knowledge fits into patient care. Even at a basic level of building awareness of travel health needs, updating routine vaccines, and referring your travelers on as needed, you will begin to apply knowledge into practice. Using the pre-travel consultation process will be your guide. The core foundation of what we do in travel healthcare is the pre-travel consultation. It is defined and standardized process that results in the appropriate or optimal preparation of each individual traveler. There are 3 key elements, including risk assessment, risk communication, and risk management. The risk assessment is the critical roadmap. Without this, we would be lost. It requires a sound working knowledge of the destination, travel health risk, geography, and types of itineraries, along with assessing relevant information on the traveler's health status. Risk management includes vaccines, prescriptions, and health information we provide. Risk communication is how we learn and share all this information with the traveler. The goal is to provide targeted care and advice to the individual's needs. I like to think of it as helping them to pack their bags. We're sorting out what they should be taking with them on a trip to help prevent, anticipate, and manage the health risks of their itinerary and what is comfortable to them. It's not helpful if we overstuff their bags and miss packing what they really need. Let's start with the who on our roadmap. The who is traveling is at the center of all this. A traveler's age, sex, health issues, medications, allergies, vaccine history must be well understood to select appropriate vaccines, medications, and health information. Most travelers do not need a physical to achieve all of this. It can be gathered through a very well-designed questionnaire. Physicals may be indicated for those with very complex health issues or people who are moving overseas. You may find, for example, that a traveler checks off on a health form that they have a skin condition, such as psoriasis, but they don't list any medications. When you ask them about this, they may confirm that they're on immunosuppressive med. You'll be hearing more about this later. This is a contraindication for receiving a live vaccine. So it's very important when people fill out health forms that you also review them with them to ensure that the information is complete and accurate. But don't forget that people are more than a list of medical information. We also need to be alert to clues and information about them, such as reference groups, cultural influences, cost concerns, and fear of needles. Also, a reminder, just because a patient is traveling doesn't mean we own all of the patient's issues. Our role is to help identify and make a care plan, but it is often necessary and helpful to reach out to primary care, managing specialists, and treating clinicians to have a more complete picture, particularly with complex medical issues. The next part of the risk assessment has to do a lot more with what they will be doing and where they're going. And this, you put your knowledge and information about destination-specific risks into focus. The trip details help us to filter the risks according to where the traveler is going and what they plan to do. We are further assessing their risks and using them to build the roadmap. You can see 3 travelers going to India, but their itinerary variables will be different and impact on the risks they may face. A short-term business traveler who will be in urban centers for 10 days won't have much risk of Japanese encephalitis or cholera, but they should consider hepatitis A, typhoid vaccine, along with some good insect repellents and minding what they eat. Consider the traveler with psoriasis. If they're going to Ghana, where yellow fever vaccine is required for entry, they can't take the vaccine due to their medication. However, is it appropriate to give them a waiver? How much risk will they have of the disease? Knowing more about their trip plans will help you with this discussion and decision. Travel health risks Travel health risks are as varied as travel itself. You'll be hearing much more about travel health risks in upcoming presentations. And of course, the CDC Yellow Book can be your guide to this part of the world. It helps us and travelers to think of risks in basic categories, such as risk of food and waterborne and insect diseases. Risk can also be from contact with infected air, think COVID, flu, and measles, animals, such where you can get rabies, skin contact with water, which can lead to a risk for schistosomiasis in some countries. Each category has its own level of risk reduction and prevention measures that may include vaccines and medications. Travel or destination behaviors and activities can reduce or enhance risk within these categories. You don't need to know the ins and outs of each risk in a category, but you need to understand general modes of transmission so you can help your traveler appreciate their risk and the general things they can do about it, in addition to vaccinations. So here's just a review of some of the risks, and we'll be going into it a little bit more. One thing to point out that motor vehicle accidents is a leading cause of death for travelers over the age of 60. So even some of the things that we offer, vaccines and all the other information, if people aren't careful and aware of injury prevention when they travel, there's really not much we can do with them. The Peace Corps actually had people stop using motor scooters because of the level of injury. Unfortunately, we can't tell people to not use motor scooters, but we can raise awareness of how risky this kind of activity can be. And of course, we take ourselves wherever we go, including pre-existing medical conditions and psychological issues. Pre-deployment physicals and fitness for duty assessments are often a big focus for expatriates and long-term assignments to help reduce repatriation due to unknown or poorly managed conditions. Sorry, I'm having a little issue with my slides here. Okay. All right. So now that you know as much as you can about a traveler in the short time you have with them, you have to formulate the risk management or care plan. Your risk assessment roadmap will help you get to this place where you can begin to see the vaccines, medications, and advice that will be most helpful to each traveler. But we are still missing an important part of the process in helping the traveler pack their bags. Risk communication is defined as a two-way dialogue. It's an exchange of information, and it is ongoing throughout the consultation. Throughout the successful risk assessment and risk management process, it's important to use risk communication and good counseling skills. This is not something particular to travel medicine, and many of us use these skills every day in healthcare and other parts of life. Listen to the traveler. Try to pick up clues about what matters to them. Telling people what to do can backfire. Framing it in ways that they can relate to will help them to better understand risk reduction measures and make informed decisions. And if nothing else, it helps them to retain and recall important pieces of information. Don't let this happen to you. This caption says, unfortunately, animals sometimes lack the necessary skills to communicate with each other. This poor giraffe is about to lose his long neck due to miscommunication. Just a few reminders on the using appropriate counseling and communication. Again, you want to customize everything, acknowledge concerns, don't overwhelm travelers. You really have to meet them where they are. Use teaching tools and decision aids. We'll get into that in a few minutes. And pause if more time or information is needed. Sometimes medications need to be clarified. They may not have all their vaccine records. They may need to wait in the lobby for a few minutes. You may need to reschedule a visit. That's okay. Don't rush. This is important stuff. And always leave the door open for follow-up questions and post-travel issues. And this is very important. Leaving the door open for post-travel issues is critical. No matter how well you prepare travelers, remember that up to 35% can have some level of illness during or after travel. We often get phone calls from travelers that we did not prepare who went to other clinics and are told by that clinic, we're sorry, we can't help you, call your doctor. And their doctors don't know what to do. I think it's a really important part of what we do to be able to provide limited post-travel triage when travelers and patients contact us. When travelers contact us after a trip, the basic assessment questions can help triage what is going on and help them to get to the next step in an evaluation. You need to know a little bit about who they are, where, and what. Timely referral for appropriate evaluation and management can be life-saving in the case of malaria. You don't need to start providing care, but we really need to make sure that they can get to the right places to receive care. Sending somebody who might have malaria to an urgent care center is a recipe for disaster in many cases. Sending them to a university-based hospital that has can manage it will be a much safer and better place. And you must remind all travelers to report a travel history. This is incredibly important. They have to remind people that they traveled, they came from Africa or whatever they've done, so that this can be considered in their workup. And instruct your staff members as well. Even the front desk staff should be, who takes messages, should be alert that if someone calls with a post-travel illness, there should be some limited information provided. Again, you're not providing care, but just helping them to get to the next step. Fever in the return traveler is really one of the most concerning things. And for someone who's been in a risk area like West Africa, it is malaria until proven otherwise. Yes, it could be COVID, it could be the flu, it could be many other things, but malaria needs prompt and specific treatment. Know enough about the geographic distribution of common travel-related diseases to be able to triage and assist your patients. So here we get into some of the what people will call the boring stuff, but it's incredibly important to best practice. And travel medicine is no different from any other field of healthcare in that we need to base what we do on a good framework. You have to have your sound knowledge, understand the guidelines and standards of care, and then things have to filter into policies and procedures that make sense for your practice. Policies are the basic rules that frame out essential aspects of care, and procedures are the steps or recipes to help everyone follow the policies. We have tools to help us, such as forms, counseling guides, and these are incredibly important. And if you are practicing within an institution or group practice, make sure to check what the standards are within your institution. Why do we need to care about policies and procedures? They provide a working definition of practice. They offer appropriate and safe practice, consistency of practice, some level of legal protection, and they develop expectations and standards of excellence and quality for both staff and clients. But again, remember there are challenges to impactful care. And one of these is staying organized, prioritized, and having time management. And this again is where policies and procedures and tools can really help. So how do you get started on policies and procedures? It's easy just to think of it from everything that you do from when the clinic doors open until closed, and even after for after hours access, should in some ways have some level of policy and procedure. Some of these will need to be very formalized, and others may just be well understood by everyone who practices. Things such as vaccine administration and storage are incredibly important to formalize. How prescriptions are managed, charting and documentation, the list goes on. And there's also administrative issues. How do you manage incoming phone calls, emails with patients, billing, after hours care, and maintaining the physical plant? All of this needs some level of policy and procedure. Some examples of policies and procedures, again, for the more important things, vaccines, adverse event management, documentation. I'll be going through a few of these in a few minutes. Vaccine storage and handling. If you stock vaccines in your clinic, make sure you are following the guidance of the CDC. Vaccine storage and handling toolkit is available online, and it is incredibly helpful and detailed. So please look that up. You can find it at immunize.org and also on the CDC website. In addition to vaccines being extremely expensive to purchase, poorly storing them can have a negative impact on the efficacy and the protection they offer. A few important cautions about storing vaccines. Do not use dorm or mini fridges to store vaccines. You can use them for very brief periods of time in a clinic, and then they must go back into the regular refrigerator for storage. Don't store vaccines on shelves or lower bins unless they are specialty designed refrigerators or freezers for pharmacy grade use. And never use vaccine refrigerators to store food or beverages. It might be tempting to leave your 5 o'clock beer in there, but please don't do it. This is not because of contamination issues, but because the more things that are stored in a refrigerator, the doors get open, can be left ajar. So refrigerators should really be dedicated for vaccines. If you work in a clinic or setting with multiple providers, someone should have the responsibility for managing the refrigerator and vaccine inventory. Assigning a vaccine coordinator can be very helpful. The other important thing to consider is all the issues around vaccine administration. Again, there are details about this on the CDC website. So please make sure if you're at all involved in this, that you and your staff are familiar with these issues. It's a critical area to be guided by policies and procedures. This is a busy slide, but so you can really look it up again, and immunize.org has all the resources. Many clinicians are surprised to learn that you do not have to wear gloves, but you may choose to, this is in the United States, or aspirate before injection. There is no evidence to support aspiration before an injection, or even take vital signs as a part of vaccine administration. These are not necessary. This saves you time for other important matters like managing to make sure you're giving the right vaccine to the right patient and so forth. Check it all out. You will likely find something to help improve what you do. And it's flu shot season here in the US. So most of us are involved in that in some way or another. If you have never heard of vaccine information statements before, this is another critical take home for all of you who practice in the United States. These are federally required standardized information sheets on vaccines. You must provide them for all routine vaccinations, and it is very good practice to use them for every vaccine. Even all the travel vaccines have a VIS. They are available in many languages, which can be extremely helpful when you're having clients who speak different languages, particularly for complex vaccines such as yellow fever, when you really want to make sure you're not missing anything. They need to use the most current version. If you subscribe to alerts from the Immunization Action Coalition on immunize.org, they will push this out to you. They will announce when new versions are available, but you can also check them periodically online. You must document in the patient record that the VIS was provided and use the appropriate date in the documentation. So a few things about vaccines to remember. Don't miss opportunities to vaccinate. This is where primary care providers really have a big role. Make sure you're keeping routine vaccinations up to date and providing your patients with a record of that. And you can simultaneously administer as many vaccines doses as appropriate in one day. There are a few caveats. Live vaccines, such as yellow fever and measles or MMR, need to be done on the same day or a month apart. And this applies to PPD as well. And you have to consider the 1-inch rule. In people that have a fairly substantial deltoid, if you split vaccines by at least an inch, you can get at least 2, sometimes even 3 if necessary, in one limb. Just make sure to document more specifically where you've given each one. And there are some exceptions. Very reactive vaccines, you may want to consider separating into different arms, particularly if you're only giving 2 or 3 vaccinations. Mild illness is not a contraindication. Moderate with fever is a precaution, but again, this will be part of your risk assessment. If somebody is about to leave or you have a child visit and they may be lost to follow-up, otherwise a clinician may decide to still vaccinate, or you can always reschedule the appointment. Lapsed schedules, there's no need to restart a series. So if somebody has missed a dose of Hep B or hepatitis A, just continue on and get them back on schedule. Always provide the VIS, and very importantly, standing orders for vaccines are available on immunize.org, and these can be easily customized to you. And they actually link to some sources of the US military that has standing orders for additional travel-related vaccines, so you can customize these as well. Vaccine providers have to be proficient in vaccine adverse events. Fortunately, anaphylaxis is very rare if patients are appropriately screened for allergies and prior history. So this is an important part of your intake form. Always administer vaccines to patients who are seated or lying down. Keep the lying down option for those who have a prior history, because it will take a lot of time to have everybody lying down, and it's really not necessary. Always monitor patients for 15 minutes. This is recommended. It may be challenging in adult flu clinics and so forth, but for younger adults, it is really recommended because vasovagal events will usually occur within 15 minutes, 80% of them. In our practice, we also try to get past the vaccine part of the visit as soon as possible. and then deal with other counseling and education. People start to get anxious as they're sitting there listening to you talk about malaria and everything else. So try to focus up front with making vaccine selections, providing the vaccines, and then focus on everything else. This may help them relax a little bit. You can also, and so they'll listen to you when you talk about malaria because they're less worried about vaccines. And it also built in a little time for you to sit there with them, or for them to still be in the clinic while the education and counseling and checking out process is still happening. Make sure that you and your staff can recognize the difference between anaphylaxis, which is potentially life-threatening response to an allergen, but is rare, and vasovagal events, which is a process that triggers hypotension and what a layperson would call fainting. Vasovagal events are more common and not related to vaccine components or allergens. They are also not treated medically. The biggest risk to vasovagal events is injury and head trauma. That is why we try to keep people seated for at least a few minutes after vaccination. Vasovagal events usually occur within moments or minutes of the vaccination. People become pale and lightheaded. They may describe that they're feeling nauseated. They won't have a rash or other signs like that. It is not treated with medication, but you may need to get them to the ground and elevate their legs. Ensure you have appropriate supplies on hand, including epinephrine to treat anaphylaxis. All of this is very well detailed on the CDC and immunize.org. So please make sure you've reviewed all this carefully. And remember that we have to make reports to VAERS, which is the Vaccine Adverse Events Reporting System. And you can find this online as well. So another really helpful thing for us to have, as I've mentioned, are forms to help us stay organized. Here are some samples of clinical forms and what to include. The patient health questionnaire helps you to gather all the information about who, where, what, and so forth. It needs to be tight and well organized to help you develop your risk assessment roadmap. So take time to really make sure you have a good patient questionnaire and intake form. Even if this is an online or part of your EMR, hopefully you can customize it. You also need a good form to document all the risk management you provide, from vaccines, medications, prescriptions, patient education, and don't forget the VIS version and consent if your facility requests that. The patient also needs a record of vaccines you give them. Most travel clinics will use a standardized yellow card. This is a standard set by the World Health Organization and adapted by each country. You can purchase them online at the US government printing office. The card must be filled out when providing yellow fever vaccine, as this is the officially accepted format. For routine and non-travel vaccines, standard vaccine recording books are available. Forms can also communicate vaccine provider. You can also provide information to primary care physicians, which is important so we can maintain people's long-term records. Examples of administrative forms, these are very specific to practices, but of course you have efficient ways to manage billing, phone and email management. You need vaccine logs to register when vaccines come in, what came in, and so forth, refrigerator logs to monitor temperatures, and patient reminders for hepatitis A. This will really, and boosters, whether these are done by email, text, or other forms, these can be very helpful. Of course, patient handouts are another very important part of what we do. Using patient educational materials and giving them to patients is not only required for the VIS, but highly recommended for other aspects of care. Highlighting the written with all that you do with written information will help with informed decision making and allow people to reference these once they leave the clinic. Keep written information simple and easy to read to reinforce the take-home points on the basics, such as traveler's diarrhea, insect precautions, and what to look for in medical evacuation insurance. I just want to pause here for a minute that every traveler should consider the need for travel and medical insurance. In the US, Medicare does really nothing for people when they're traveling overseas. So for your more mature population, and many insurance companies also offer very little support. They may not even pay for care that is available overseas. One of the most important things is that people can have a phone number to call and someone who will assist them, making sure that they're getting the appropriate care when they're overseas. So it's important to mention this to all travelers. Remember that travelers will also have their pre-travel visit weeks before a trip, sometimes even longer. So sending them home with a packet of information that's customized to them will help them remember and follow through with all the recommendations you've offered. So I'm going to start to wrap up now and just leave you with a few more points to consider. It's really important to think of where you practice again and what your population is, so you can develop care models and staffing needs appropriately. If you're practicing with specific populations that may be more complex, you may need to allot more time for a consultation. The average consultation is 20 to 30 minutes. So you have to think about how are you going to fit all this in, and if you're going to need more time in some situations. And you may need more time as well as you're developing your practice and your expertise. If you plan to offer yellow fever vaccine, keep in mind all the extra responsibility this comes with, as it may bring all types of travelers into your clinic. Not all travelers need the same length of appointment. For example, clinics that offer yellow fever may have an option for a brief appointment if they're referred from a physician who has already provided some of the vaccines, perhaps the malaria prescriptions, and you can focus mainly on the yellow fever. What is the best staffing and care model? In some practices, a single provider can do most of this. And an experienced nurse in New York State who is well-trained and experienced can, under standing orders, provide the full spectrum of travel healthcare in many facilities. Other practices may split a visit between a physician, a nurse practitioner, and a nurse and a PA. Whatever model works for you, make sure everybody is properly trained. You can share and cross-train staff, which is also another cost-effective and time-saving way to manage developing a travel clinic in your practice. Think about how your support staff can offer help with non-clinical functions. And remember, regardless of where you practice, make sure to base what you are doing with a good understanding of the knowledge base and standards of care. And remember, it's all in the CDC Yellow Book. This has been a very quick review and hopefully will help you to see all the pieces that need to be brought together into carefully pulled together patchwork quilt that can serve your travelers as long as they can fit it into their suitcase. So today you'll be hearing more about these pieces, and I wish you all lots of luck in pulling it all together. Thanks, and thank you.
Rebecca, thank you. I hope we can distribute your slides. Is that okay?
Yes.
Everyone is asking. This is really an amazing overview, and you did a lot in 45 minutes. I think we have time for maybe one question. I had a question too, but I can save it for the break. Which medical evacuation insurance company do you yourself recommend? Somebody asked.
Okay, I mean, there are many of them. One of the ones that seems to consistently offer very robust service, and they support many organizations and corporations, is International SOS. And they also have care for individuals. There's a company called MedJet, World Nomad. I think what's important is for people, like with any insurance, to understand what they're getting, and to make sure that there will be phone numbers, email contacts, because what really matters in many cases is that people can contact someone who knows the resources in the country where they are to help them get to appropriate care. They may not fly you home, but you want to be able to get to the best care